I have been given the honor to introduce Ed Poliandro, who will introduce his co-presenters today. All right, and Ed and I go back a couple of decades, if not more. So I don't want to age him. After a certain point, I no longer worry about aging myself, right? Ray and Nate and Scott. I think you know what I mean. Well, I should speak for myself. Okay. So anyway, so we have a treat ahead of us today. This is a rare opportunity to hear about a program and its impact to be shared by a faculty person, Ed Poliandro, and student leaders who have participated and actually who have regularly picked up the baton year after year and helped to advance these very important language proficiency programs here at Mount Sinai, despite some extraordinary odds. And so let me just say a little bit about Ed, and then he will in turn introduce the students to you all. So Ed Poliandro, I think most of you know him. He has introduced other speakers to Meta Grand Rounds in the past, but let me just share a little bit more about him that you may not know. He's been involved in cultural competency education for a good 20 years now. In 1992, he established what was then called the Mount Sinai Cultural Diversity and Medicine Program, which later was integrated into the work in CMCA. This program at the time was the first in the country to utilize a multicultural, interdisciplinary faculty teaching team to develop and teach cross-cultural curricula to medical students, residents, and faculty. In 1999, he co-founded the Northeast Consortium for Cross-Cultural Medical Education and Practice and served as its first president. The NEC consists of 12 medical schools and residency programs in the Northeast dedicated to collaborating, developing, and integrating cultural competency curricula and to required undergraduate and graduate medical education and to influencing healthcare policy on regional and national levels. He currently chairs the Mount Sinai Culture and Health Work Group's Residency Training Committee on Cultural Competency Training. This group consists of residency directors from Mount Sinai and its affiliate institutions who are working together on developing and integrating cultural curriculum into required ACGME core competency guidelines. Ed has also given various grand rounds, seminars, and faculty development workshops, and has consulted with other medical institutions on providing health care to diverse patient populations and communities. He's also one of the course directors for our MPH Clinical Research Training Program course on cultural competency in public health and community research. His research interests include the impact of culture and spiritual beliefs on utilization of mental health services for inner-city children and families. He continues to serve the mental health needs of patients in his cross-cultural psychotherapy practice. Today, he is joined with other student leadership on some of the programs that relate to culture, particularly language proficiency, and he will, again, introduce them in time. Let's welcome Ed Poliandro.
Thank you. Thank you, and good afternoon. I also want to express our delight in being here, with my co-presenters from the Medicina and Español and the medical Mandarin. So we have Nikhil Menon, Nydia Ekasumura, I practiced that, Nydia, Annie Kim, Brittni, Micham, Jessica Harris, and Paul Peng. Where's Paul? There you are. Okay, so welcome. Before getting into why we're here, I have another round of thanks for three people who have been just wonderful to us in the evolution of these language programs in medical education. And so the round of thanks is to Rainier Soriano, to Erica Friedman, and to Michelle Sandhay for the various ways they've done student mentoring, helping us think strategically about funding, and also preparing some of the data that you're going to be seeing for publication and research design. So what I'm going to do as an introduction is to provide you with a practical and conceptual framework of why we're here, Why are these programs important in medical education? And the practical framework is very easy. The California Endowment and the federal statistics show that right now, 8% of the US population, or roughly 25 million people, are considered as having a limited English proficiency. In a couple of years, that's going up to 10%. So clearly for us all in this room, we do understand that that presents a huge barrier to healthcare delivery and therefore a health disparity. So we grapple as to how to respond to that. And in checking with AAMC and preparing for this grand rounds, I was told that we don't have any data, official data of all schools that are offering programs such as ours. That's forthcoming, they said, by the end of next year or the beginning of 2014. But we do have informal data, and I'll be glad to share and answer any questions about that in various schools as to what's going on, at least in the New York area. From a conceptual point of view, as you see from the title, that we're looking at our language training in medical education as a pathway for developing culturally able physicians. Because we really believe that the way to address this disparity and all disparities is to prepare our students to be culturally able physicians in everything that they do, in all walks of medicine. So that's what you're going to be hearing as we go along. So what about the language training programs here at Mount Sinai and what makes them unique? Well, first, it's a combination of classroom learning and they're community service oriented. As you will hear from my co-presenters, you'll see some action in the community where they are practicing. Many language programs in medical schools right now, because of time, because of resources, go in and teach medical terminology and get out. We do it differently. We believe in all kinds of learning, formal and informal. And actually, for the teachers in the room, you know informal learning can be sometimes even more powerful than the learning in the classroom or in the lab. The benefits, students, first of all, the educational experience is enhanced because students have a chance to practice not only a language, but what they're learning with you. And that's another thing about our language programs here, that they are mirrored of what is going on in ASM 1 and ASM 2. And lastly, it's something that we are all concerned about is how can we always build a better relationship with our community and the students being in the community, as in many service learning programs, are ambassadors of what we want and the kind of relationship and interaction we want with the community. So something about the conceptual framework. When you boil it all down, and perhaps you all as the other faculty, educators in the room might agree with this, all life is interrelated and depends on connection. And as human beings, that connection is manifested in human communication. And what do we mean by human communication? Human communication is verbal and nonverbal. And as many of us know, or all of us know in the room, sometimes the nonverbal communication is much louder than anything verbal, and sometimes truer than what's said verbally. So that really puts challenges us all, whether in English or any other way, to really think about what kinds of skill sets do we all need, and especially do we want to equip our students with about communication. And as the umbrella of all of this is a cultural context. So language and culture are intertwined. And another great thing about our programs is it's not about, do you have a fever? Do you have pain? Do you smoke? It's really understanding the lived experience of people and how their behaviors in that lived experience affect their health, their illness, and their wellness. So we see cultural context in everything. And of course, part of the culture of medicine as we know it how does all of this impact on patient-centered care and health outcomes? How can training students in language as a pathway to be culturally able students have positive impact on patient-centered care and outcomes? So this is the way we see education happening. See if you can relate to this in your respective areas. We start with the physician or student physician, and he or she has a relationship. It's all about relationship building in the cultural context and the language of the patient, and then developing that context with the community. So it's a relationship that we teach the student of how do you relate to your patients, but patients come from places just as we do. How do you relate to the community? So that's relationship building. Students then learn about the health systems and their language. And health systems and different parts of the health system has a different kind of language. We're talking about language as in Chinese or Spanish, but we're also talking about different language of systems and cultures. And then finally, students have to interact with the social systems of the patients, of the community, and the social systems of this institution, because we are all interrelated. And then there's society, which we're all a part of. So in breaking it down, one of the things that we want to communicate is that there are many skill sets that we are teaching our students about in general, and to be aware of especially through language and the learning of a foreign language. This is, let me take this one. If you look down, this is where we all meet in education, if we're looking in. This is what we do. Those of us who are teaching, those of us who are learning, and I would posit that all of us are teaching and learning each other all of the time. And what goes into this learning and this interaction? Well, first it has to do with being culturally aware of each other, and then of the people we are privileged to serve. And of course, it's teaching whatever we are responsible for in our specific areas about communication. How do I communicate what I'm learning medically, for example, to a patient, to a group, or to a community, or to the state, or to the federal government? How do I communicate that? And of course, everything is community outreach. And this is something, as you very well know, is part of our culture and what we do at Sinai anyway. The community being an inpatient setting or out in the community. So today, you're going to be hearing about the history of the program. They're going to have a chance to tell you their story, how it began, what went into it, what is the curriculum, and its application in the community. As well as evaluation and recommendations. And it's great for us as faculty to hear what students think and what we'd recommend to us. As I mentioned before, the pathway, the language programs are one pathway to becoming culturally able physicians. I just included for your reference looking at other pathways where we've been working together. For example, in ASM 1 with Joanne, and then 2 with Joe and Jenny, and the culturally able physician that we do in ASM 1, and in the medical interpretation and LGBT healthcare, where we are working with second years. Spirituality and health is how we partner with the spiritual care department. Why is that important, and why are we bringing it up here, and why may it appear in doing it in a different language? Because we view spiritual beliefs and religious practices of people as part of their cultural context. So it makes total sense and that's about an integrated model of healthcare delivery as well. LGBT healthcare, as I mentioned, we are working with the student groups as well as with ASM2, and the MPH and clinical research programs where MD, PhD students have a chance to meet with physicians and genetics people to also address culture and research, for example. And finally, in residency training, as you heard Gary mention. So what I'm going to do is I'm going to turn it over to Medicina, but I'd like to ask you a question, a couple of questions. If what you hear today, if you could think about how in your respective areas, as experts in your respective areas in education, can you apply any of what the students are going to be, student leaders are going to be sharing with us? Or how does, in your area, can we expand the learning of what it means to be a culturally able physician? That would be very helpful for us to know, to see how we can be of help to you in doing that. Thank you.
Excuse me. So, hi everyone. Thanks again for coming. My name is Nikhil Menon, and along with my co-coordinators Kim and Nydia Ekasumura, we'll tell you a bit about Medicina en Español and why we believe that it's so important for students here at Sinai. And just in the interest of time, I may breeze through a couple of the slides relatively quickly, but just so you know, the more detailed version is there in your handout, so you can use that for reference. So Medicina en Español began several years ago with what was then the Spanish Conversation Club. And members of the club got together every month to practice their conversational skills over lunch. But what they really felt they were lacking was a way to interact with their Spanish-speaking patients. So they felt a growing need and interest in a more formalized educational program in order to learn the medical terminology associated with the clinical setting and patient interaction. So with the CMCA's support, they developed a pilot which they ran, and they being the leaders of the Conversation Club at the time. They developed a pilot that they ran in the summer of 2005. And to teach the course, they partnered with the Primera Language School, which is a professional organization that teaches Spanish to mainly businesses, but now to medical schools as well. And they hired professional instructors, which and that's been a strong partnership that we've maintained even until now. So the pilot in 2005 was very successful. It was very popular, and several students had signed up. And so the first official course was held in the fall of the same year, in 2005. It was highly popular, so much so that they decided to hold it again in the spring. And since then, the course has been held twice per year, once in the fall and again in the spring. But until 2007, it was actually a huge struggle for the leaders each year because they had to obtain funding either from external sources or from grants from within the hospital. So we received funding guaranteed from medical education in 2007, and that really alleviated a huge burden from the leaders each year and allowed us to focus more on our programming and move ahead with that. So for that, we were very grateful. So Medicina en Español has several program goals. And I've listed a couple of them here. To foster cultural competency within the student body and improve communication with our diverse patient population, and also to strengthen the relationship between the medical school and the Spanish-speaking community in order to better understand and serve their needs. So this right here is really why the three of us became more interested and involved in medical Spanish. And that is, we believe in the power of true effective communication. And effective communication, we think, and by effective communication, we mean both the Spanish language skills and knowledge of the accompanying cultural nuances that really go hand in hand, have the potential to improve health outcomes and, as Dr. Poliandro mentioned, decrease health disparities and increase the overall satisfaction of the interaction of both the physician and the healthcare provider. So I'll tell you about a few of our activities. As I mentioned, the Medical Spanish Semester course is our most popular course, and that we hold, as I mentioned again, in the fall and in the spring. We really focus on an interactive instructional curriculum. So even though we do have a professional instructor, and there's one instructor to a class of maybe 8 to 10 students, we have one instructor from Primera who's technically the teacher. We have a lot of breakout sessions where we have the students break into pairs and do a lot of physician and patient role playing in order to better simulate the patient interaction. And also we bring in standardized patients. So these are 3rd or 4th year students that are familiar with the medical exam and history taking and who are fluent in Spanish and are able to help the medical Spanish students hone their skills. And lastly, we also tried to integrate the curriculum with that of ASM1, such that what the students learn in medical Spanish are the same skills that they learned in ASM the week prior. So this has a dual purpose. First, it allows the students to reinforce the skills that they just learned. And also it allows them to expand those skills into a knowledge that will allow them to broaden their patient base. Uh-oh. There we go. So here's just a quick shot of our medical Spanish course from this fall. And our newest course, which we're very excited about, is our EHOP interpreter training course. And this course didn't exist last year. In fact, last year was when we were doing most of the planning and coordinating for it. But we held a pilot of the course in 2012 in the summer, so this past June. And we only had a couple of students, but we got some great feedback and were able to hold the first official course with 23 enrolled students this past fall. So the EHOP interpreter training course is a course required for EHOP for students who are interested in being medical interpreters at EHOP. And the way we organize the course is really very interesting. The course focuses on the role of the interpreter and teaches students how best to fulfill that role. And we hear from both Primera Language Schools, so the professional instructors, and one of the things that they brought to the table this time, which was really great, was that one of the teachers was able to instruct the students as to the different cultural terminologies and variations and customs that are seen in the different backgrounds of patients in the EHOP patient population. So this was really one of the things that our students found very helpful. Then also we hear from Dr. Helen Fernandez, who has had extensive experience with working with interpreters, Maria Cardona from the hospital's interpreter services program, and Omaira Rolon, who is a clinical social worker at EHOP. And using all of these different perspectives allows for a very diverse array of speakers and really a good overall view of how interpreters can best fulfill their role in the clinic. And, and I forgot to mention, but we're currently doing a research project on the EHOP course just to figure out how effective it was for our students, and Nydia will talk about that in a minute. So this is a quick shot of one of our interpreters working with a senior clinician in EHOP a couple weeks ago. And then a couple more activities that we do are we hold an immersion course in the summer, and this is really a crash course for third-year students before they hit the wards. This is not really meant to teach them Spanish so much as a couple of words and phrases that may be useful to get them through an encounter with an only Spanish-speaking patient. And we also offer a summer exchange program for 4 weeks to a hospital in Valladolid, Spain. And this has been a really highly popular program with the students who have gone. And students learn how to practice medicine in another country and under a different healthcare system. But perhaps the most important part is that they learn to practice medicine and live in a distinct culture. And really broadening their horizon there, they come back being more culturally able student physicians. And lastly, we do a couple of other programs that are more fun programs, but no less educational. In the past, we've had conversation lunches and Spanish movie nights for students in order to encourage them to enhance their conversational skills, as well as to expose them to different areas of Spanish and Latin American culture. And this is just the group from our Valladolid exchange program this past summer.
Hi everyone. So because we all love math, I'm going to be talking about some data that we have collected for our different programs in Medicina. So the first is the spring and fall semester Medicina course. Prior to every course, students are given a placement exam to place them into 3 different levels based on their previous level of Spanish. So after the course, students are also given a final evaluation. The test measures the students' knowledge of medical Spanish vocabulary, their mastery of grammar, as well as their communication skills in Spanish. As you can see, there's a significant increase in students' level after taking the course, the largest being among the beginner group. But we can also see an increase among the intermediate and advanced group. This suggests that the course is able to increase students' Spanish knowledge among students who previously have no knowledge of Spanish, and among students who may be able to speak and understand Spanish, but not necessarily medical Spanish, or Spanish in the sense of a clinical. setting. This suggests that the program is effective in improving students' Spanish throughout, regardless of their initial level. Aside from the test, we also asked the student to fill in a survey to note down their perception of their Spanish skill after taking the class. In this question, students were asked to rate their comfort in holding a basic conversation in Spanish. In a 1 to 5 scale, students rate an average of 3.7, suggesting that they are leaning towards being more comfortable in holding a conversation in Spanish after taking the course. In the same survey, students were asked where they are able to use the Spanish that they learned in class outside of it. So a good number of them write down EHOP, ASM clinical site, as well as LCE. This suggests that the students are able to transfer the skill that they are learning in the course in patient-related encounters that they are experiencing throughout their preclinical years by participating in these activities. In other words, it suggests that medical Spanish augments the clinical skills that the students are learning throughout their education years. Next, I will talk about the EHOP Spanish Interpreter Program. As Nikhil mentioned, ESIP is designed to help students who are planning to be an interpreter in EHOP. We asked the student to rate their comfort in interpreting, their knowledge of their role as an interpreter, meaning such things as interpreting to a first-person point of view, their knowledge of where they should position themselves in a clinical interview, as well as their knowledge of the different variances in terminologies or cultural practices that they may encounter among different various patient population. As you can see, there's an increase in these measures after taking the course. Currently, we are assessing whether this measure is correlated with the clinician and patient's perception of the interpreter's ability. We plan to present this next year in a poster conference, so you can keep an eye out on that. Lastly, I will talk about immersion. As Nikhil mentioned, immersion is a crash course in medical Spanish targeted for incoming third-year students. We asked the student to rate their comfort in different aspects of history taking in Spanish. Among such things that we asked are their comfort in taking chief complaint, HPI, and past medical history, as well as their ability to build a rapport with their Spanish-speaking patient. As you can see, there's a significant increase in all these 4 measures after taking the course. We are currently assessing whether this trend is continued 6 months into their rotation to see the long-term efficacy of the immersion program. So from the different data that I have presented, we can see that medical Spanish appears to increase students' knowledge of Spanish. However, how does this relate to the patient experience? Unfortunately, currently we don't have any measure of that, at least in paper. However, based on our personal experience working in EHOP, in ASM, or in other extracurricular activities that we are involved in, we can see the importance of language, and by knowing such language, the variety in culture that we can encounter throughout our patient-related activity. Recently, I was volunteering in the Hurricane Sandy relief in Far Rockaway. There were no interpreters available, and we came across one patient who was a Spanish speaker. He was able to speak a broken English, so we first started conducting the interview in English. However, he seemed a bit hesitant. So my colleague, Jessica, who will talk next, and I immediately switched to Spanish. At this point, he became more comfortable. Although our Spanish is not perfect, we were able to communicate with him, and he seemed to be more open to talk to us. He was able to give us a more in-depth version of what his medical condition is, what medications he needs, and he was even telling us about his past, coming from the Dominican Republic, working in the hotel industry, and his injury that he sustained, which prevent him from working. He felt comfortable enough with us to the point that he brought us to his home. In his home, he introduced us to his wife, who is purely Spanish-speaking. We later found out that his wife has a heart condition, so we were able to do a physical examination on her to make sure that she was okay. So just based on this experience and many others, as I'm sure my fellow colleagues can attest to, we believe that knowledge of language and culture, especially that such knowledge of language can bring, is important in students' ability to perform patient care with their patient. So as our recommendations in the future, we believe that we won't go so far as to say that all students should take medical Spanish or medical Mandarin. But we would like all students to recognize the important role that language and culture plays in students' education. Such an understanding of language and culture can allow students to be more sensitive, perceptive, and empathetic towards the patient, looking at a patient as a whole instead of just a medical case. In the future, we would like to expand the scope of our Medicina class into include more community outreach and cultural education by helping our students to go into the community to practice their Spanish by teaching diabetes or nutritional education, as well as reaching out to the Spanish-speaking geriatrics population through associations such as the Union Settlement or other student service-oriented organizations. We are also currently trying to, in a process of changing our leadership to other students who are also as passionate about language and culture such as us, and they're present in this room as well, there. As well as continuously trying to gather more data and improve the quality and efficacy of our program. So we would like to thank everyone who has been participating in Medicina, from our faculty advisors to the coordinators in the past, without whom this is not possible.
Hello, everyone. Thank you all again for coming today. We're really excited to be here and to be able to provide all of you with a glimpse into medical Mandarin at Mount Sinai. Or in Mandarin, 西奈山医院.
一科中文.
So really quickly, I'd like to bring you back a couple of weeks to Hurricane Sandy, where in the middle of the night, around 2 or 3 a.m., Bellevue evacuated about 20 psychiatric patients, the majority of which were Chinese-speaking. And so we were able to help send in volunteers, and Paul, our third leadership member, was actually one of the volunteers that went in. And I'm sure later on he'd be more than happy to share with you his experiences. So medical Mandarin really exists at the junction of these 3 core principles: communication, community outreach, and cultural awareness. And we believe that all 3 are really equally essential. So a quick snapshot of our group. This is our 6th year. This organization is completely student-run. We have 2 classes, a beginner's class and an advanced class. They both meet twice a week for 1 hour each time, Tuesdays and Thursdays on the 13th floor of Annenberg. And we hire in a private teacher who's been working with us since the beginning, and she's really wonderful. We're heavily involved in various service projects, which we'll talk about later. And we also host crash courses and conversation tables. So who we are. Medical Mandarin consists of 1st and 2nd year medical students as well as graduate students. And Paul, Brittni, and I are the leadership of this year. And so a quick word about why we're doing this, because I suspect we're not the faces that you'd expect to see running Medical Mandarin. So my story, really quickly, is that I began studying Mandarin in college after taking a trip my senior year of high school to China, fell in love with the country, the language, decided I needed to learn more. So that summer, my freshman summer, I went to study abroad in Taiwan. I continued taking Chinese in college, decided to major in it, and then my junior year, I went back. I studied abroad in Beijing for a semester, and that summer I studied in Shanghai with the U.S. State Department's critical language program.
And my path followed about the same as Jess's. I was a Chinese major. I also studied abroad, and what really cemented my desire to integrate Mandarin into my career was the year I spent in Taiwan as a Fulbright exchange teacher. And that's me with my 2nd grade class on a field trip.
So there really is a need for medical Mandarin, even in our community. You can see in the past 10 years in East Harlem alone, there's been over a 200% growth in the Asian population. And this Asian population is predominantly Mandarin and Cantonese speaking. And you can see here that the need for interpreter services, both in phone and in person for Mandarin, has skyrocketed. And I'm sure that this trend has continued through the present.
So this increasing prevalence of Chinese language, not only in New York, but also here at Mount Sinai, highlights the importance of programs like Medical Mandarin and also the importance of our 3 core principles. And we believe that the practical manifestation of these principles is education. So I'm going to say a little bit about the simplest and yet most important education initiative, which is our language classes. As just said, the beginner class meets twice a week for a grand total of 2 hours every week. The class is for anyone who's interested in Chinese language, Chinese culture, but has never really encountered it before. So it's a conversation class, you're learning basic Chinese, and we welcome everyone. It's mainly students because of the times we hold the class, but there are grad students, and occasionally we get faculty or staff that come to participate. The instructor is Miss Ling Chen, or as we call her, Chen Laoshi. She is a professional language teacher from NYU. We sort of stole her away, and she's been wonderful for the last few years. And she teaches so well that occasionally we have students who begin with no Chinese at the beginner class, take it for a few semesters, and actually advance to our advanced class. And the advanced class is much more medically oriented. As you can see here, this is the fall syllabus that the three of us created. We revised it entirely this year based on student feedback and our own experience from taking the class last year. It mirrors the curriculum of ASM 1. This is a big push to make sure that students learning the concepts of ASM 1 are also going to be able to integrate them into their Chinese practice. So it's front-loaded in the beginning, as you can see, with cardiovascular system, abdominal exam, the nervous system, everything they're learning in ASM 1. And then towards the end of the semester, you get much more of the extracurricular activities which allow you to integrate these concepts in a more casual way. So patient interview day, we have a doctor from Mount Sinai Hospital who speaks Chinese come in and act as a standardized patient. And extracurricular activities like linkage house visit, which we'll talk about later. Another push we've made this year is to actually collect data on how well we're doing. So at the beginning of this semester, we gave a proficiency test to both levels, and at the end, we'll give another one. And we know that medical Mandarin is effective, so we want data to reflect that. And as we have mirrored the ASM 1 curriculum, ASM 1 has responded by integrating medical Mandarin into their curriculum. So we've worked with Dr. Hoisak, and now medical Mandarin's clinical options are open to any student in ASM 1 who wishes to go to a Chinese-speaking area. So there's options in Flushing, Chinatown, and the Charles B. Wang Clinic. And actually, Paul and I were assigned to a clinic in Flushing last year, and it was a geriatric practice, mostly Mandarin, occasional Cantonese, and it was honestly one of the most integrative experiences I've ever had of my love of language and my desire to communicate and my medical school experience. So we believe this is one of the greatest accomplishments we've had so far. And we also have faculty members, not just to hook faculty members up with mentees, students, but also because it's a wonderful way to get to know what it's like to be a Chinese-speaking practitioner. We have a picture here of one of our patient interview classes. That's Dr. Fred Koh, and he is pretending to be, for us, a geriatric patient with a chief complaint of dizziness, I believe it was. We had a Chinese dinner. It was very informal, but it was still a very important learning experience for the students to take a full interview in Chinese, to do a full differential diagnosis in Chinese, and then to discuss in Chinese afterwards geriatrics in general with Dr. Koh.
So our second core component is community outreach, and we at Medical Mandarin are strong proponents of taking what we learn in Medical Mandarin and in ASM, combining them and going out into the community. So we have several East Harlem initiatives. One of them is Linkage House, which Brittni mentioned earlier. We're actually going there on Friday. It's a community not too far from here, within walking distance, and it has a large Chinese-speaking group. So we often go there. One of these photos is from the Chinese New Year celebration, and another is us conducting vision screening. So another chance for us really to take what we're learning in ASM and put it to practice. We're also involved in several translation initiatives. We worked on translating documents for a diabetes intervention, which Paul spearheaded last year, so he can talk more about that later. And we also translated several hepatitis documents, which brings me to one of our other initiatives. We've been working with HONE, the Hepatitis Outreach Network here at Sinai, and it's a group that's involved in screening, vaccination, and education for high-risk minority populations. And so last year, I, along with several other medical Mandarin students, drove out to Flushing to a Chinese community center, and we conducted patient interviews in Chinese, and were actually able to administer the vaccinations ourselves. And the third core component, cultural awareness, is something that we think is arguably the most important, because cultural awareness is really integral to any language, and language without being used in its appropriate cultural context is really meaningless. So in this light, we host a crash course once a semester, and we invite any faculty and staff to attend. We teach physicians how to interact with Chinese patients, how to greet their families, and we also touch upon other sensitive topics. And here you can see a picture of our conversation tables, which we host several times throughout the semester. We have one we're planning for Monday, if you'd like to attend. But it's a very informal environment, a chance for people interested in Chinese and Chinese culture to gather. We order in Chinese food, and we sometimes provide different activities. And the photo over here on the right is a worksheet where we taught anyone who attended how to write Mount Sinai in Chinese characters. It's held in Annenberg on the 13th floor. Yeah.
Mm-hmm. And it'll be Monday from 1 to 2 on the 13th floor, if anyone would like to attend. So funding is honestly the greatest onus that gets passed year to year. As you know, second-year students in the spring pass the leadership on to the first years every single year, and every single year we go through the hoops of reapplying for funding. We get funding from not only the Center for Multicultural Affairs, but also from the Chinese American Medical Society. They provide us with a grant that we apply for every year. Our operation budget is pretty modest, and 95% of it goes to our instructor, Ms. Chen, and 5% we reserve for activities, because I think, again, as Jessica said, the cultural awareness is so important.
And lastly, looking ahead, we like to ensure stability. As Brittni mentioned, we like to smoothen the transition between past and future leadership. We'd also like to see the future leadership continue the initiatives that we've started this year, like the proficiency test and an attempt to gather more data. And lastly, we would really like to ensure sustainability, to ensure that medical Mandarin can continue year after year for future Sinai generations, especially as the need for Mandarin speakers becomes more apparent in our community. And we really look to you, our school, and MedEd for your continued support in medical Mandarin's growth.
So we'd just like to thank our faculty advisor, Dr. Jenny Lin, our newer advisor, Dr. Nai, who's here today, and our instructor, Ms. Ling Chen, Drs. Angel Palmero and Edward Poliandro from the Center for Multicultural Affairs, and then, of course, the Chinese American Medical Society. So thank you very much.
Thank you.
Okay, so thank you. We have time for questions and comments. Scott, could I invite the leaders to come up, please?
When you do your research projects, be interested potentially in seeing data about the following aspects of this. I speak 150 words of Spanish, and I speak them very fluently. I cannot have a conversation about anything other than diarrhea and vomit. But I don't need a translator in a room when I'm taking care of a kid. And the only, I don't think I understand the difference between the Dominican population and Puerto Rico. I have no cultural awareness at all. But the thing that strikes me is that the patients are so grateful that an educated person is taking the effort to sound like a moron. They can feel more comfortable. It's so tangible to me over these many years. And I wonder if you plan your research projects, whether there's some way to capture the patient's perception of their physician as a doctor, or their interest or their empathy, as opposed to the conversation.
Mm-hmm.
We could definitely try to address that in the future. It's just a bit difficult because there seems to be for one, the IRB getting through to ask for patient survey is going to be difficult.
You know, this room has the worst acoustics. So when you respond, please use the microphone.
Sorry. So first, it would be difficult to do a a study on the patient population, because that would require us to follow a group of probably third-year medical students during their clinical rotation and ask about the patients. However, we're doing a similar survey for our ESIP course that I briefly mentioned, the EHOP Spanish Interpreter Program. In that project, we plan to approach the patient to actually ask them about their perception of the student interpreters that are in the clinic. So hopefully we can get a better understanding of that question once we get the data back from the study. But in the future, we would like to try to see the patient's response too.
Oh, no, just that I agree. That's a great point for the future. Right now, or at least in the past, our research projects have been mainly focused on the efficacy of the course by talking to the students, from the perspective of the student, whether the course was effective. But I agree that that's a two-sided coin, that the patient is going to be the one also evaluating whether the doctor or student doctor is an effective communicator. So we will definitely look to that in the future.
There's something else happening here. One of the things that I'm most excited about, and I see that we as a school are making a contribution to the medical center, is that we've developed a partnership with the interpretive people, with Maria Cardona. I mean, it was started in the days when Rainier was developing and implementing the medical interpreter program. So the way I envision this is that through patient satisfaction, which is a general survey, this could be an easy question, easier than going through research protocols and everything you have to do. That's not to discourage what the student leaders are saying, but I'm already thinking of other ways that we can do this. And we can make that contribution, because people do comment and say, no matter what doctor said, she or he tried in my language, and that just made me relax. So I'm glad you brought it up. Thank you. Other comments? Yes, Ed.
I was wondering if the Spanish group has looked at your alums that have gone to training in residency, maybe in places like when you train in Colombia, 85% of your patients are Spanish speaking. I was just wondering, it might be something, you have enough people out there that are probably Spanish is important, and get their satisfaction and how they felt when they went there and how relative to the other people that were training with them.
We're talking 6 months.
Yeah, we can talk about
So we are trying to get together the emergent data the 6 months follow-up, we asked them immediately after, did it help? And yes, you saw from the data results, it helped. But 6 months after, do the effects of the class kind of still remain? So we're still trying to collect that data. And it's all about follow-up. It is very hard to follow up, people go to residencies all over the place. So that would be a great idea to see if not just months down the line, but years down the line, are they actually able to incorporate what they learned in these emergent classes and in Medicina classes. But again, that's something that we'd definitely want to look into.
But I think the 6-month post course is a more powerful
Assessment.
of the effectiveness of the course opposed to years later when they're in practice, given the fact that there's so many variables that could happen. So getting them at the middle of the third year or during their clinical years in the third and fourth year after Medicina probably be a better result in terms of the impact of the course opposed to other variables that may happen during their residency program.
I was thinking of it more from creating a level of importance that it actually makes a difference in when you train, and kind of getting up a population of students to in essence participate on that basis, and that it actually helps you be a better doctor and makes it somewhat easier in terms of the transition. So that's a very different, I think it's a different goal.
Dr. Ronan, it's probably also a self-selecting group that chooses to participate in the emerging groups, right?
Getting Dr. Ronan's data would help you make the case that you should make everybody learn Spanish.
We'd love to.
Or Mandarin.
Yeah.
I apologize. At my age, it's difficult to remember names. So if I can address those that went to either Spain for an elective and or your experience
Very true. So let me just understand the question here. The difference between what I experienced in Taiwan as far as how I learned from it and what I internalized from that experience and what I can get so much closer just in Flushing. Okay, well, in Taiwan, it was me teaching. It was me teaching English to 1st to 6th grade students. But at the same time, I did take classes at a local university to better my Chinese. And every day that you go in and you realize that you need to meet the children halfway, that you need to understand the cultural context of what you're saying to them, even if you are teaching English. That really internalized for me why you need to learn at least one other language. It's just to know what it feels like to be out of your bubble and to be out of a situation in which you're comfortable. So even if I'm in a room with a Spanish-speaking patient, which is a language I do not speak, I can at least understand and relate to the idea that this is not a comfortable situation. And then when Paul and I went to Flushing last year for our clinical site visit, it was, you could see the relief on a patient's face when they realized that these two students who are kind of awkwardly looming off to the side spoke Mandarin and could communicate and did understand some of the cultural push and pull, that they would just relax a little. And they were comfortable with Paul and I sitting in the room when the doctor would leave and Paul and I taking a history from them. And they would smile and a patient's wife would smile and throw a few anecdotes in. And I think that's what we can get.
The question did not, it was an unfair question.
Okay.
I was trying to see what the importance of the clinical context
The clinical context.
in Flushing. I didn't realize it was a teaching experience.
I'm sorry. Yeah. The clinical importance is.
I had a question about the Cantonese. I think I know enough about Chinese that you wrote it in, when you did the home study, it was actually written in Chinese characters as well as in kind of an English translation.
Right, it's called
Is that how you
pinyin.
did it? Is that how you dealt with the Cantonese? Because
Exactly. Cantonese and Mandarin have the same written system, but spokenly they're virtually incomprehensible.
yeah, that's right. So
Exactly. So we use that English transliteration system or the Chinese characters to mediate.
Interpretively, in terms of the census, does the census distinguish between Chinese dialects when it takes the census so that we know that Cantonese is actually being replaced by Mandarin?
So I'm one of the advisors for the group for Mandarin.
Yeah.
I speak both Cantonese and Mandarin.
Mhm.
So basically what happened, all Chinatown are Cantonese.
Yeah.
So if patients are 40 or older, you can presume that they can actually speak Mandarin because that's the official language in the state. And majority of our East Harlem patients are still in that mix. So, but they usually would be able to understand Mandarin because Cantonese is a totally different language.
Okay, it's about that time. We want to thank you for your interest, and if there are further questions that come up from our discussions, we're open, because as you heard from the student leaders, they are building and very passionate about this, as are we. So we want to see how we can develop this even further. So thank you very much, and special thanks to our student leaders.